I want to tell you about Harold. Harold was 74 years old, retired carpenter from rural Tennessee, broad hands, straight back, the kind of man who built his own garage at 68 and then stood back and looked at it the way a man looks at something he made and is genuinely proud of. His granddaughter called him the strongest man alive. She was 9 years old and she meant it literally, because Harold could still lift her over his head and spin her around, and she would shriek and laugh, and that sound was his favorite sound in the world. I want you to hold that image, Harold spinning his granddaughter. I'm going to come back to it. Because 2 years after that photograph was taken, his daughter sent it to me later and I kept it. Harold could not lift a gallon of milk off the bottom shelf of his refrigerator without his arms shaking. He could not walk to his mailbox without stopping halfway to rest his legs on the fence post. He could not get up from his recliner on the first try. He would rock forward, brace, and push. And sometimes that was not enough. Sometimes his legs just would not hold. His wife started sleeping lighter, not because she was told to, because something in her knew, without words, that she needed to be listening. Harold told me later that the worst moment was not the weakness. The worst moment was the morning he heard his granddaughter ask her mother, in that loud, honest voice that 9-year-olds have, "Why doesn't Grandpa spin me anymore?" He was in the next room. His daughter did not know he could hear. He sat in that kitchen chair and he did not cry, but he told me his chest felt hollowed out, like something essential had been taken from him quietly, while he was not paying attention, by something he could not name. Harold had not had a stroke. His heart was functioning. His diet was reasonable. He was not sedentary. He still moved, still tried, still showed up every morning. But Harold had been getting weaker for 3 years. And in 3 years, not one person had connected his decline to what was sitting on his bathroom shelf. I am Dr. Natasha Adekunle. I have been practicing internal medicine and geriatric health for over 30 years. I have sat at bedsides, reviewed charts, delivered difficult news, and made calls I wish I did not have to make. And what I found in Harold's chart, when I finally looked at the full picture, made me angry. Not at Harold, not at the doctors who treated him, but at a silence, a gap in the conversation that is costing seniors their independence, their strength, and in some cases their lives, every single day. In this video, I am going to tell you what I found in Harold's chart. I am going to explain exactly what it does to your muscles, your bones, your energy, and your balance. And I am going to give you the precise steps to protect yourself starting this week. But I need you to stay with me, because what I reveal in the middle of this video, specifically the mechanism that almost no one is talking about, is the piece that will change how you think about everything. And if you leave before we get there, you will have the fear without the solution. Before we go any further, where are you watching from today and how old are you? Drop it in the comments. And tell me, are you dealing with unexplained muscle weakness, heavy legs, or fatigue that rest does not fix? Because this video is specifically for you. When Harold first came to see me, I did something that almost never happens in a standard 7-minute appointment. I sat down and I read his chart. Not just the last visit, all of it. Every prescription, every lab result, every year going back. And what I found was a pattern I have seen hundreds of times in 30 years of practice. Harold was on a statin, had been for 6 years. Now, before I tell you why that matters, I need to explain something about what is happening inside your muscles right now. Because most people have never been told this, and without understanding it, nothing else in this video will make full sense. Your muscles, every muscle in your body, from your thighs to your heart wall, run on cellular energy produced inside tiny structures called mitochondria. Think of mitochondria as the power plants inside each muscle cell. They burn fuel and produce the energy your muscles need to contract, move, hold your weight, climb a step, lift a grandchild. Those power plants require a specific fuel molecule to function. It is called CoQ10, coenzyme Q10. Without CoQ10, the power plants go dim. Muscle cells cannot produce adequate energy. They cannot contract with full force. They cannot repair the normal daily damage that muscles sustain just from living and moving. Over time, slowly, quietly, the muscles weaken. The legs feel heavy. The grip loosens. The energy disappears. I call this the CoQ10 drain, And here is why it is happening to millions of seniors without anyone connecting the dots. Your body produces CoQ10 through a specific biochemical pathway in the liver, the mevalonate pathway. It is the same pathway your body uses to produce cholesterol. Statins, the most widely prescribed class of medications in the United States, taken by more than 40 million Americans, work by blocking this pathway to reduce cholesterol production. But here is what almost no one tells you. When statins block the mevalonate pathway to reduce cholesterol, they block CoQ10 production at exactly the same time. The same switch, the same pathway. One pill, two consequences. Your cholesterol goes down, your doctor is pleased. Your numbers look excellent on every panel, and inside your muscle cells, the power plants are going dim, running on a fraction of their normal fuel, quietly failing. Not dramatically, not all at once, but consistently, measurably, every single day you take that pill. This is the CoQ10 drain, and this is what was happening to Harold. If you have been on a statin and you have noticed that your energy is lower than it should be, that your legs feel heavier than they used to, that recovery from even light activity takes longer, type "the drain" in the comments. I want to know how many of you are living with this right now without knowing its name. Now. I promised you something in the middle of this video that most people never hear. We are there. The CoQ10 story is real and it is serious. But there is a second layer to what statins do to aging muscle, and this one is the piece that I believe explains the severity of what I see in my practice. A mechanism that has barely made it out of research journals and into mainstream conversation. Your muscles have a repair system. It runs constantly, patching the microscopic tears that happen every time you walk, stand up, carry something, climb a stair. The workers inside this repair system are special cells called satellite cells. They are the muscle stem cells, the ones responsible for growing new muscle fiber and maintaining what you already have. After 60, satellite cell activity naturally slows. This is part of why muscle preservation after 60 requires more intentional effort than it did at 40. You are working with a slower repair crew. But here is what the research is now showing, and what your doctor has almost certainly never mentioned. Statins impair satellite cell function directly. Multiple studies have now documented that statin exposure reduces satellite cell proliferation, meaning the repair crew not only works more slowly with age, but the medication your doctor prescribed is actively reducing the number of workers showing up. Think about what that means in real terms. Every day, your muscles sustain normal wear and tear. Every day, satellite cells are supposed to arrive and patch those tears. Every day you are on a statin, fewer of those cells are functioning properly. The tears accumulate, the patching falls behind. The muscle degrades faster than it can be rebuilt. A study published in the Journal of Applied Physiology followed senior women through a 12-week structured exercise program. Half were on statins, half were not. Same exercises, same effort, same commitment. The women on statins showed 35% less improvement in muscle strength than the women not taking statins. 35%. Erased. By the pill they were taking every morning, the one they had been told was protecting them. If you have been exercising, doing the work, showing up, and still feel like you are going backwards, type "this is me" in the comments, because this may be exactly why. When I ran Harold's full panel, including tests that are almost never ordered in a standard appointment, here is what I found. His CoQ10 level was less than half of what it should be for a man his age. His muscle enzyme markers, indicators of active muscle breakdown, were elevated. His muscles were not just weakening, they were actively being broken down at a rate his body could not match. His testosterone was critically low. Because here is one more thing statins do that no one mentions. Testosterone is produced from cholesterol. When statins suppress cholesterol production aggressively, they suppress the raw material your body needs to produce testosterone. And testosterone, even at the modest levels appropriate for a man in his 70s, is critical for maintaining muscle mass, energy, and physical resilience. Harold's muscles were not failing because he was 74. Harold's muscles were failing because for 6 years, the medication he had faithfully taken every morning had been quietly draining the fuel his muscles needed, impairing the repair crew responsible for rebuilding them, and suppressing the hormone that helped maintain them. He had done everything right. The system had failed him. Does Harold's story sound familiar? Does it sound like someone you know, or like you? Type Harold in the comments. I read every single one. Before I give you the action plan, and I am going to give you a specific step-by-step protocol you can begin this week, I need to make sure you have the complete picture. Because the CoQ10 drain and satellite cell impairment are the most important pieces, but they are not the only ones. Blood sugar and the inflammation spiral. Multiple large-scale studies, including analysis from the Women's Health Initiative involving tens of thousands of women, have shown that statin use significantly increases the risk of developing type 2 diabetes, particularly in women over 60. One major analysis found that women on statins had up to 48% higher risk of developing diabetes compared to women not on statins. Now here is why that matters specifically for your muscles. Elevated blood sugar accelerates muscle protein breakdown. It promotes systemic inflammation, and it impairs the insulin signaling pathways your muscles require to absorb protein and rebuild after any physical activity. So statins may be driving the exact metabolic environment that makes muscle loss worse, through a separate pathway entirely from the CoQ10 story. Two fires burning simultaneously. If your blood sugar has risen since starting a statin and no one has connected those two facts, type connected in the comments. Nerve damage and the balance you think is just getting older. Some research has linked long-term statin use to peripheral neuropathy, nerve damage that causes numbness, tingling, or weakness in the hands and feet. In seniors, neuropathy in the feet is one of the leading contributors to falls and balance problems. If your feet feel numb, if your balance feels off in ways you cannot fully explain, if you feel unsteady on surfaces you used to walk without thinking, this is worth a direct conversation with your physician. Memory and brain fog. In 2012, the FDA added a safety warning to statin labels regarding reported cognitive side effects, including memory lapses and confusion, primarily in older patients. Most reported cases resolved after discontinuing the medication. I am not claiming statins cause dementia. The research on that is genuinely mixed. But unexplained memory fog, word-finding difficulty, or confusion in a senior on long-term statin therapy is a conversation that deserves to happen, not be dismissed as just aging. Now, enough of the hard truth. Here is the part I have been building toward since the moment I told you about Harold sitting in that kitchen chair, chest hollowed out, listening to his granddaughter's question through the wall. I have shown you the problem in full. Now I want you to take a breath, because here is what I have also watched in 30 years of practice, and this is the part that drives everything I do on this channel. I have watched seniors in their late 70s rebuild strength they thought was gone permanently. I have watched men who could not climb their own stairs carrying groceries again within months. I have watched women who gave up on their gardens get back into them, not because of a miracle, because of information, the right information at the right time, followed by action. You are at that moment right now. Let me give you the exact steps. I want to be absolutely clear before anything else. Do not stop any medication without talking to your doctor. That is not what this is about. Stopping a statin abruptly, particularly if you have cardiovascular risk factors, carries real consequences. This is a conversation to have with a medical professional, not a decision made alone at midnight after a YouTube video. What this is about is giving you the tools to have that conversation with authority. Because many seniors are on statins who should not be. Many were prescribed them under guidelines that have since been significantly revised. Many have never had a proper risk-benefit discussion that accounts for their age, their muscle health, and the quality of their daily life. Write these down, put them in your phone, bring them to every appointment from this moment forward. Question 1. Am I on this statin for primary prevention or secondary prevention? This is the single most important question. Secondary prevention means you have already had a heart attack or have established cardiovascular disease, and there is meaningful evidence statins help. Primary prevention means you are taking a statin simply because your cholesterol number was elevated. The evidence for primary prevention in seniors over 65 is far weaker than most patients are ever told. Do you know which category you are in? If you have never been asked this question, type "never asked" in the comments. Question 2. What is my actual 10-year cardiovascular risk score? There are validated clinical tools, including the pooled cohort equations, that calculate your actual percentage risk of a cardiac event over the next 10 years. Current guidelines do not strongly recommend statin therapy for seniors with a calculated risk below 7.5%. Do you know your number? Has anyone calculated it with you? Question 3. Has my CoQ10 level ever been tested? Almost no doctor orders this, but if you are on a statin and experiencing muscle weakness, fatigue, or pain, CoQ10 depletion is a direct, testable, measurable possibility. Ask for the test by name. Question 4. Is there a lower dose option with less muscle risk? Muscle side effects from statins are dose-dependent. Higher doses, more muscle damage. If some statin therapy is truly necessary for your situation, lower doses carry significantly reduced muscle risk. Ask whether your current dose is the minimum effective dose for your profile. Question 5. Can we conduct a supervised statin holiday to evaluate my muscle symptoms? A temporary, medically supervised pause in statin therapy while monitoring cardiovascular markers is a legitimate clinical tool. Many patients experience significant improvement in muscle function within weeks of pausing. If symptoms resolve and return when the statin resumes, that is important information. Ask whether a trial pause is appropriate for you. Any doctor worth their degree will engage with these questions respectfully. You are not being difficult. You are being an informed patient. There is a difference, and a good physician knows it. While you are preparing for that conversation, there are things you can begin immediately. CoQ10 supplementation. If you are currently on a statin and cannot change your medication status immediately, CoQ10 supplementation is one of the most important protective steps you can take. CoQ10 is available over the counter and is generally very well tolerated. The form matters. Look specifically for ubiquinol, not ubiquinone. Ubiquinol is the active, bioavailable form that aging bodies can use directly, without the conversion step that many seniors' bodies struggle to perform efficiently. For most seniors on statins, doses in the range of 100 to 200 milligrams of ubiquinol daily are commonly discussed. But discuss the dose and any interactions with your physician or pharmacist before starting, particularly if you are on blood thinners or heart medications. Protein, non-negotiable. After 60, your muscles become what researchers call anabolically resistant. They require significantly more protein to trigger the same muscle-building response that required less protein at 40. If your muscles are simultaneously being depleted by the CoQ10 drain and satellite cell impairment, adequate protein becomes even more critical. Aim for 25 to 30 grams of high-quality protein at each meal, not spread thinly, but in meaningful amounts at every sitting. Eggs, chicken, turkey, salmon, plain full-fat Greek yogurt, cottage cheese. These are your allies. This is not a suggestion. Without adequate protein, no supplement, no exercise program, and no medication change can fully compensate for what your muscles are losing. Gentle resistance exercise, starting exactly where you are. I am not talking about a gym. I am not talking about heavy weights or anything that puts you at risk. I am talking about resistance bands, chair squats, wall push-ups, slow, deliberate movements that ask your muscles to work against resistance, however modest, on a consistent basis. When muscles are challenged through resistance, they send a direct biological signal to the body to maintain and rebuild. Without that signal, your body defaults to breaking muscle down rather than preserving it. Even 2 to 3 sessions per week of 15 to 20 minutes makes a measurable difference. I have seen this in patients in their late 70s and early 80s. The biology is there. It is waiting. Vitamin D. Get tested. Vitamin D deficiency is extraordinarily common in seniors. And statins, by interfering with cholesterol-based metabolism, can further impair the body's ability to utilize vitamin D effectively. Vitamin D is directly involved in muscle function, calcium absorption, and fall prevention. Ask your doctor to check your 25-hydroxy vitamin D level. Optimal range for seniors is generally considered to be 40 to 60 nanograms per milliliter. Below that, supplementation, under medical guidance, is a simple and inexpensive intervention with meaningful benefit. Anti-inflammatory foods. Statins can contribute to low-grade inflammation in muscle tissue, the same inflammation they are sometimes claimed to reduce elsewhere. To counteract this directly, prioritize fatty fish like salmon and sardines, extra virgin olive oil, walnuts, blueberries, turmeric, and dark leafy greens. These are not exotic, they are at your grocery store right now, and the research supporting their impact on muscle inflammation and recovery is solid and consistent. I want to tell you about one more patient before I close. Margaret was 67 years old, retired school librarian. She had been a reader her whole life, a woman who knew the card catalog of her library from memory, who had read every book in the children's section twice, who organized community reading events on weekends because she loved bringing people to books. She came to see me because she was scared. Over 18 months, her legs had deteriorated to the point where she had fallen twice, once badly enough to catch herself on the kitchen counter. She could not tend her garden for more than 20 minutes before her legs gave out. Getting up from low chairs had become a physical negotiation. She told me, and I remember this exactly, "Dr. Hargrove, I feel like my body is betraying me, and I cannot understand why." She was eating well. She was walking every day. She had done everything right. 5 years earlier, her doctor had written a statin prescription. Her cholesterol had come back slightly elevated at her annual physical, not dramatically, just above the target number. The prescription was written in minutes. She had filled it that afternoon and taken it faithfully every day since. 20 milligrams of atorvastatin, right alongside her blood pressure medication. No one had ever mentioned muscle side effects. No one had ever checked her CoQ10. No one had ever asked whether a woman with her specific risk profile, no history of heart disease, no cardiac events, minimal risk factors, actually needed this medication. When I ran her full panel, her CoQ10 was less than half of what it should be. Her muscle enzyme markers were elevated. The CoQ10 drain had been running in her body for 5 years. We worked with her prescribing physician to properly reassess her cardiovascular risk. She was low risk. The statin was not clearly indicated for her profile. Under proper medical supervision, she transitioned off the medication. We started CoQ10. We adjusted her nutrition significantly and added a gentle resistance program. 6 weeks later, Margaret told me her legs felt different, not fixed, different, like something had started moving in the right direction. 4 months later, she was back in her garden. 8 months later, she sent me a note, handwritten. She still writes by hand. It said, "I feel like I got 5 years of my life back." That note is still in my desk drawer. Margaret's outcome is not a miracle. It is what happens when seniors receive complete information and then act on it. You have worked hard your whole life. You have contributed, built things, raised people, served your communities. You have earned the right to carry your own groceries, to walk in your own garden, to sit at the dinner table at your grandchild's birthday and stand up easily when it's time to go. That is not too much to ask, and the path back to it begins here, with information you may never have been given, and questions you now have the language to ask. You are not broken. Your body has been working against compromised conditions. Change the conditions. Most people will watch a video like this, feel the weight of it, and then put their phone down and change nothing. They will not write down the 5 questions. They will not call their doctor. They will not look up ubiquinol. They will go back to the same morning routine, the same pill from the same shelf, and wonder why nothing is changing. But you are not most people. If you were, you would have left 15 minutes ago. So here is what I want from you right now. Type day 1 in the comments if you are committing to one action from this video. Just one. Write down the 5 questions. Look up your statin category. Order a CoQ10 test at your next appointment. Pick one thing and start. Tell me in the comments, Which of the 5 questions are you going to ask your doctor first? I read every single comment. I want to hear from you by name. If this video gave you something, if it gave you language or clarity, or just the feeling that you are not imagining the changes in your body, share it. Share it with someone you love who is over 60. Share it with their adult children. You could be the reason someone gets their strength back. You could be the reason a grandfather spins his granddaughter one more time. Subscribe to this channel if you have not already, and hit the bell, because next week I am going to show you the single most important blood test that almost no senior is being offered. A test that reveals exactly how fast your muscles are breaking down at the cellular level, and what the results tell you about which specific interventions will work for your body specifically. That one is not optional. This is Dr. Natasha Adekunle. Harold, by the way, 14 months after we addressed the real cause of his decline, sent his daughter a video. She forwarded it to me. It is 12 seconds long. Harold is in his backyard. His granddaughter is running toward him with her arms out. He catches her. He lifts her. He spins her. She shrieks. He laughs. 12 seconds. That is what the right information at the right time looks like. I will see you in the next video.